put a lot of labels to weirdness in the last 10-15 years. In that sense, I think if anything, people are very conscious about mental health. I would like to see maternal mental health be valued more.
Right.
So in Indian society, even this basic thing is not given importance, that to help the mom postpartum, don't make her recover from an unneeded surgery. Treating that woman like an adult who is in a vulnerable time but definitely still has some degree of autonomy and agency on her or over herself. I really want to see the government put more pressure, regulation and auditing on the kind of outcomes that maternity care hospitals are putting out there.
We are at Empowering Minds 2026, and if you ask me why are we here, we are here to discuss critical mental health questions about women's mental health. So who do we have here? We have social entrepreneur and philanthropist Janhavi Nilekani. Welcome, ma'am. Thank you so much for being here with us, and I hope we have really good conversation around this.
Thanks so much for having me.
So now my question initially is going to be, are we talking enough about women's mental health and specifically about maternal mental health? Are we talking enough about it?
See, my view is yes. I know that typically, especially in recent years, I think there is a lot of focus on mental health in general. Therapy culture, so to speak, over the last 15 years has become extremely mainstream. You hear all these stories of people self-diagnosing, I have ADHD, I'm on the autism spectrum. Like, we put a lot of labels to weirdness in the last 10-15 years. In that sense, I think if anything, people are very conscious about mental health or very quick to, label the normal range of human experience and emotion as maybe something pathological. I think when it comes to maternal mental health, there is a lot of much more awareness, but maybe still not much importance given to it.
Right.
People are definitely aware of the baby blues, the fact that it can be a tough time. There's even increasing awareness of full-blown postpartum depression. But nonetheless, people don't prioritize or value that. Like, systems are not set up to support the mom postpartum, and including the mother herself doesn't set up systems to support herself before postpartum. So definitely more work to be done there.
And what do you think are the changes that you want to see in this regarding maternal health care? And
I would like to see maternal mental health be valued more.
Right.
And that includes a series of things, right? Like, at Aastrika, we put a lot of work and effort on evidence-based maternity care. So, using interventions only when required, not doing unnecessary C-sections and episiotomies and inductions and augmentations, in part because those do carry side effects and those do create a tougher recovery and more morbidity for the mother. Right? So in Indian society, even this basic thing is not given importance, that to help the mom postpartum, don't make her recover from an unneeded surgery. Of course, C-sections are valuable, but the mother's recovery and well-being is given very little weightage. Right? When that decision is taken, the value is not placed on it. So one is just that, like, prioritizing the mother's physical recovery in maternity care itself can help, because when the worse you feel, the harder it is to sort the rest of things out, right? Definitely families being more focused on the mother's experience, being sympathetic to how hard it is. It is a tough time. Postpartum is a tough time. Making sure she has the kind of emotional atmosphere, but also still has autonomy, still has agency, not necessarily forcing a lot of outdated, restrictive postpartum rituals, and treating that woman like an adult who is in a vulnerable time, but definitely still has some degree of autonomy and agency on her or over herself.
Right. As a woman working in this space, how do you personally protect your mental well-being in this very emotionally heavy space?
I think I'm able to stay fairly detached from what clients or pregnant women or postpartum women are feeling. I won't say it never affects one. Certainly there's some tragic stories which of course affect even you emotionally. But overall, I think I'm able to keep that separation from work in the rest of my life.
And how do you consciously avoid developing this savior complex when you're working in this
non-profit space?
Yeah.
I don't think you're constantly faced with setbacks. Moving any program through the government is so much time, patience, effort. I don't think that we really have I think it's too hard to get things done for people to feel a savior complex, because executing any development sector program is quite challenging.
Right. If we are talking about policy changes that you want to see in this space, what is something that you earnestly really want to see?
I really want to see the government put more pressure, regulation and auditing on the kind of outcomes that maternity care hospitals are putting out there,
Right.
right? Because there isn't auditing, there isn't stat collection, and the outcomes in terms of unnecessary morbidity to mothers. I'm not talking about safety. Safety for mother and child is pretty mainstream in vast majority of India. Of course, not in every low resource setting, but in a lot of our country. But value and importance is not placed on the mother having the least morbidity and side effects, and that is something I would really like to see more policy focus on for women's sake.
I hope you had a good conversation with us.
Thank you so
and
much.
This was
That was
really
fun.
very nice talking to you.